Hi, everyone. Thanks for joining us for today's 1 hour free webinar from Prevention Plus Wellness, located here in beautiful St. Augustine, Florida. As I look out my window today, it's sort of partly cloudy, actually, a little unusual for us here. And I hope it's nice where you guys are at and that you're all well. And thank you for joining us. So my name is Dr. Shelley Wirch, and I'm president and founder at Prevention Plus Wellness LLC. We have these weekly free webinars. Of course, we also have 2-hour online program implementer and training of trainer workshops associated with all of our programs for youth and parents. And you can learn more about all of that on our website, preventionpluswellness.com. So today we'll have about an hour together. I'm happy to stay with you as long as you'd like. As you have questions or comments as we go along, please feel free to find your chat option at the end of your toolbar where it says more with the 3 horizontal dots, and you can point your cursor at that, find that chat space. And as we go along, ask any questions that you'd like. If there's anything that's unclear or anything that doesn't make sense, let me certainly help you with that. So 1 hour today, and we'll have Q&A at the end of today's session, and everyone will get a 1 hour CU certificate. You just type in your name and make a copy for your records. You'll also get a link to this recorded session, which you're welcome to share with your friends, your colleagues throughout your region, state, or nation. And no PDF this time because I'll actually be showing you images of our actual program. So today is unique because this is a webinar about our, I believe this is our only multi-session or multi-lesson program. All Prevention Plus Wellness programs used in evidence-based practices, screening, and grief intervention. And they're all 1 session in length, except for Sport 2. So Sport 2, which is an alcohol and drug prevention plus wellness program, is actually 6 sessions in length. Now, some prevention and health specialists will implement to you the sport program, the 1 session evidence-based program, and then follow it up with Sport 2. Others will go directly to Sport 2. So let's take a look at these objectives. I've had them up here for a while. I'm sorry for that. There's 5 of them. Let me walk you through them very quickly. By the way, did you notice the title on this? Because I really wanted to focus on the fact that because this is a multi-session program, it is particularly of interest to professionals and settings in schools or wherever you have youth for multiple opportunities for instruction and motivation, and particularly in my mind, health education class, physical education class, sports, etc. So this is a great program for those settings and those professionals. And so let's take a look at our objectives. Number 1, I'll be walking you through the content in the 6-session Sport 2 PPW program. Again, that's Prevention Plus Wellness. We have a high school version, middle school version, and elementary school version. So you can cover the whole range of youth development. Secondly, we're going to look at the scripts within the manual so that you can see that there's a script to implement these programs to youth one-on-one as well as in a group, in person as well as online. So very, very flexible, designed to reach the maximum number of youth in your area. Thirdly, we're going to review as I said already, the manuals. We'll look at some PowerPoint slides and give you an idea of that. I'll talk about the reproducible materials. Just to give you an overview very quickly for those of you that are not aware, if you're interested in Sport 2 or any of our programs, normally what will happen is you'll be shipped a physical manual, an actual hard copy, spiral bound manual with scripts to provide your program to youth individually or in a group. and you'll receive a link to the digital download of all the reproducible materials. This includes your PowerPoint slides and anything that you need to copy, so you don't have to come back and continue to order anything from us. You can make as many copies and implement your programs to countless numbers of youth and young adults. So that's 3. Number 4, let's see, we're going to talk about training opportunities, particularly the fact that we offer a 2-hour online or on-site program implementer training and 2-hour online or on-site training of trainers. The training of trainers becoming more and more popular because if you become trained as an implementer and implement your program once, then you can come back and get trained as a trainer, and then you can train other implementers and providers throughout your organization and region. So you could save yourself training costs that way, and you can have those live trainings, and you can control those the trainings, when you do them, how you do them, and so forth. Or when you do them, we do use a standardized procedure to maintain fidelity and the effectiveness of training. So you get training materials, in other words. So I'll be talking to you about that, showing you that from our website, and also I'll be showing you the fact that Prevention Plus Wellness programs do address national health education standards. So for those of you that are concerned about that or need to address that in your curriculum, the Prevention Plus Wellness programs, including Sport 2, do address really important standards in national health education standards. Okay, so that is, those are the objectives. That's what we're going to be focusing on. So let me just pause at this point and ask a question. See if I can get some feedback from you. We've got a small group here, so I think this will work just fine. If you could find your chat space, let's just have everybody introduce themselves very quickly, so we can see who's online. Just give me your name or your organization or your location, or all 3 if you want, your name, organization, and location, just to see who's online with us to see today. So we've got good morning. We got people from Indonesia, which is awesome, which is amazing, isn't that? We got the miracles of the internet and Zoom. We've got people from not just Indonesia, but Georgia. There's some differences right there. Georgia and Indonesia and Oklahoma. So we've got people from the East Coast, the West Coast, and the far lands of Indonesia. Anyone else on that want to share where they're calling in from? Let's see, we've got just the last minute here if anybody else wants to share. We've got people from Missouri, all beautiful states. Detroit, awesome city. We've got Chris from, let's see, Center for Family and Life and Recovery. We've got people from New York, Mexico. Can you believe it? That's awesome. So it's so exciting to see people where they call in from. We got people from Michigan and more people from New York. And we got Warren County Incorporated, a family connection of Warren County Incorporated. We got more people from all over the place and different kinds of people. So thank you guys for sharing where you're at or who you're with and who you are. So thank you so much for that. So what I'm going to do today is I'm going to start with, and I'll pull it up right now, I'm going to start with the high school version. So if you want to see some of the other versions, again, what you need to do is just let me know. You've got that chat space, you've got Q&A options, and in fact, let's start with the slides first. I think that'll make it a little bit more interesting. Let me expand these slides for you. So we've got the high school version. I'll start here. If you want to see the middle school version, you want to see the elementary school version, just let me know. I'll just say this about the differences. Very similar content, obviously different developmental level, and certainly what you're going to see are different images. So here, for example, you can see the first slide is for 2 high school adolescents. You're going to see largely older adolescent images. Elementary school version of Sport 2, you're going to see children, 3rd, 4th, 5th grade, etc. So that's a very important key difference, because when you show these slides and when you talk to your children, your young adolescents, your older adolescents, you want to show them images of themselves, representations of themselves, so they can see themselves in these pictures. So there's the cover slide. When we go through our 2-hour online training, we talk about how you can co-brand this cover slide, or even tailor your slides. We cover that in the training. So this is the complete the screening survey. So just a little overview for those of you that are unaware of PPW programs. As I mentioned before, there's screening and brief interventions. There's 3 components. There's screening you through their current health habits to increase their awareness of the health behaviors. There's providing feedback on those behaviors using positive image communication designed to trigger future images of themselves being more fit, active, healthy, successful. This increases motivation for change. And then, of course, also discussing how substance use interferes and is harmful to those positive behaviors and benefits and images. And then 3rd step, action phase, initiating behavior change, having young people start improving their health behaviors, increasing their health behaviors while avoiding a harmful substance use. So this is a great 6-lesson or 6-session program for a health education class, for a PE class, because it does, and let me just say this, the 6 sessions of the sports PPW program are 3 sessions on physical activity, 2 on nutrition, and 1 on sleep and stress control. So I should actually, let me show you this first. But here's the actual manual. Here's the high school. I'm switching back now to the manual. This is the high school version. I want to show you the table of contents. Here's the table of contents. It's the same for the high school, middle school, elementary school versions. So you've got the introduction and directions, but then you have your 6 lessons. Notice in section 2, 3, and 4, it's lesson 1, 2, 3. They're on 3 different types of physical activity. So this would go, and does go very well within a sport or recreation or PE setting, or just a general health course, health education class. The key difference is that it's not just educational, it's also very much motivational and aimed at walking young people through developing a concrete self-regulation skills to learn how to set goals, monitor goals, and to change their health behaviors over time. So notice you've got the first lesson addresses moderate aerobic physical activity. The second, vigorous physical activity or exercise. The third, muscle strengthening. So you've got 3 different kinds of physical activity that are addressed in the first 3 lessons. By the way, some organizations will go through all 6 of these lessons. They're designed to be provided in this order, but you could tailor them if you want. If you don't want to cover all 3 physical activity lessons, you can cover 1 or 2. And then the next 2 lessons, lesson 4 and 5, are on healthy eating and then monitoring food and calorie intake. So you get 2 nutritional lessons that go with the physical activity lessons. And then lastly, lesson 6, very important, pulls it all together, addresses these other critical behaviors of getting adequate sleep and controlling stress. So it's a very much a holistic physical and mental health program. And remember, as a prevention plus wellness program, it integrates the avoidance of substance use prevention messages. So it is truly a holistic curriculum and addresses in whole health of young people. So I wanted to show you that first. So I'm going to go back now to the slides where we were starting, and let's take a look at the slides. I'll walk you through the slides. I think the slides are very illustrative of the content, of the core content. We just expand the slides for here. There we go. So we got the cover slide, then the next slide says, complete a screening survey. That's the first of 3 parts of your program implementation, screening, feedback, goal setting. Remember that? So here's screening. And then after the youth have been screened on their health habits, and I'll show you that. We'll go back to the manual. I'll show you the questions on what's being screened. They're going to present content. Now, the first part of the content in this Sport 2 is sort of an introduction to the topic. So here it is, lesson 1, moderate aerobic physical activity. And you can see some very important content there. You can see some great images of healthy, happy, older adolescents. And if you look at what we're doing here, what we have presented for you is we've got 2 things. You've got your text, which is your content, which represents the core messages that you're presenting when you read your script from your manual. And then you've got your images in your illustration to show young people so they can see images of themselves. That's why we have both genders, different ethnicities, different fun activities, and lots of healthy, happy young people are shown in these slides. So trying to combat, if you will, the constant overbearing and barrage of negative images young people see in today's social media like YouTube. I'm not picking on YouTube, but I'm just saying, it's just see hundreds of thousands of young people demonstrating how to use the Juul e-cigarette, for example. So here's something different, it's positive, and you get the positive image and content. Notice to the left, when you look at the content, that moderate aerobic physical activity is critical to being fit and active. Notice fit and active are highlighted in this Sport 2 program. They're image terms, so you can highlight those, you can emphasize those, or they're even emphasized in the text, because these are believed to be the terms that cue or trigger an unconscious image of themselves in the future. Young people want to be fit and active. Older people want to be fit and active. Old people and parents want their kids to be fit and active. So these are very much universal desired image terms. Must be most days of the week, 30 to 60 minutes. So there's some instruction here too. What is moderate aerobic physical activity is defined. Now, after that initial slide, then there's the benefits. So it's sort of a 2-step messaging process. One step, the benefits of this particular wellness behavior, which is moderate physical activity. The second step is how substance use harms that or interferes that. So here we got benefits. You can see the, again, positive image. They're skateboarding, or not skateboarding, they're rollerblading. And on the left, you've got lots and lots of positive outcomes. Image terms are highlighted: attractive, strong, physically fit, and even some more. Alive, confident, successful. There's another slide, more benefits. So there's a little bit more content and emphasis of benefits in the Sport 2 program and the Sport 1 program. Some of these are non-image based, but nonetheless, they're worth mentioning, and their benefits like sleeping better, controlling and losing weight, growing stronger bones, etc. So all of these are benefits. These are 2 slides on benefits. Benefits and more benefits of moderate aerobic physical activity. Then comes the risks. Here's where alcohol, tobacco, e-cigarettes, marijuana, etc. interferes with, is harmful to the achievement of an active lifestyle, being physically fit and participating in moderate physical activity. And so here you could see harms your motivation to exercise, hurts your performance in sports, decreases energy and coordination, causes fatigue, bloating, weight gain. So you can see how we're linking how alcohol, tobacco, drug use Marijuana even can interfere with you engaging in and benefiting from moderate physical activity. And then there's a recommendation. You're providing a recommendation for youth to, number one, not just stay away from alcohol, cigarettes, e-cigarettes, drug use. You could add anything you want there, but get 30 or more minutes of moderate physical activity most days a week and together. And now we're linking it again back to the images, physically active, fit, and in shape. Okay, so that's the messaging framework, if you will, or sequence. So just to review it one more time, you've got, your introductory slide. You're going to go into the screening survey. You're going to read your script, and you're going to give youth an opportunity to reflect on their current health habits. The first slide is an introductory slide and lays the groundwork for what is moderate aerobic physical activity and how it's generally or overridingly important to image. Here's 2 slides on the benefits. Then there's a slide on how substance use is a risk to moderate physical activity, benefits, and images. And lastly, recommendations. So you're going to tie it all together. You're going to recommend for that individual or group of youth, avoid the substance use and engage in the wellness behavior. And together, they'll lead you toward these very desirable and motivational images. And then the third part is goal plan. So you walk them through the goal plan. So that's the 3-step process. That was lesson 1. So let me just, lesson 2 will focus on vigorous aerobic physical activity. The third lesson will be muscle strengthening, and you can see the images change, the content changes. And now I just wanted to show you lesson 4, healthy eating. So just sort of to contrast them a little bit. So healthy eating, here's sort of the introductory slide. Regularly eating nutritious foods helps you look healthy and strong. Those are very, very powerful image terms. Includes all kinds of healthy foods in your daily diet. This is instructional. Look at the different kinds of foods. We're emphasizing fruits and vegetables because they're so rarely eaten on a regular basis by young people. Did you know that 41% or so of youth have only 1 or less than 1 fruit and vegetable a day? That's National Youth Risk Behavior Survey data of high school students across the nation. And then, of course, other healthy foods, whole grain carbs, low-fat dairy, low-fat protein. All of those are defined in the lesson. So that's an introductory slide on healthy eating. What is it and why it's important? Then 2 slides on the benefits of healthy eating: clear skin, strong bones, healthy body weight, feeling, looking good, boosting energy, performance, handling stress, personal appeal, lots of good stuff, physical and mental best. And then what are some risks to healthy eating? And of course, alcohol use and misuse and drug use and can interfere with nutritional uptake. And so again, recommendations: avoid substance use, eat a variety of healthy foods together, healthy, strong, good, and perform at your very best. So really, really powerful, motivational, instructive content, a great curriculum for health or PE class. Lesson 5 is all about monitoring calorie intake. Really, really good content here about water consumption, about, what is it, healthy eating, avoiding diets, and so forth. Really, really important for young people. And that's lesson 5. And then lesson 6 is really a powerful lesson as well. All of them are a powerful lesson. And they're really, we sort of step this up so that it's almost a foundation, physical activity, a foundation to physical and mental health, followed by nutrition, followed by sleep and stress control. All very important in that pyramid of improving physical and mental health. So you're addressing sleep, you're addressing stress control, very important. There's some images, calm, stress-free young people. We have an uptick, of course, of suicide, considering suicide, days of feeling stress and discomfort in their lives. Young people, very, very common nowadays. So these strategies are very important, this content, and motivating youth to set goals so that they be focused and peaceful and calm under pressure, and help them deal with mild depression and anxiety and excessive worries in their life. And that includes getting sleep and engaging in stress control strategies that are all discussed in this script. And of course, what are some risks to having a stress-free or less stressed life? It's substance use, alcohol, tobacco, drug use can cause stress and interfere with you being peaceful and calm and relaxed and stress-free. Okay, so those are the slides. Let's go back to any questions about the slides. Now's the time. Hop on your chat, ask a question, and we'll get to that shortly. So let me know if you have any questions about the slides. Those were the slides for the high school sport too. Let's go back to the manual and let's take a look at how the manual is laid out a little bit. Here's your introduction and steps for implementation. Let's just take a look at the first lesson, moderate aerobic physical activity. So the first thing you'll see, and again, you also remember, in addition to your manual, you'll receive a digital download of all these things you need to make a copy of, including this, your screening survey. So this is the screening survey for lesson 1 of a moderate aerobic physical activity. Now, unlike our other PPW programs, which integrate all these behaviors in one lesson, for example, sport addresses not just substance use, but physical activity, nutrition, sleep, stress control, did I say breakfast? All of those are within that one lesson. Here, the lessons are separated, so you can have a little bit more in-depth focus, and you give youth an opportunity to set goals on all of these and sort of build the self-regulation skill to shape their own health habits. So the first screening survey is, of course, addresses moderate physical activity. There's only 2 questions on the screening survey. It's just 1 page. The first is, what moderate intensity physical activities did you participate in the last 12 months? Sports and chores that increase your breathing and heart rate, but not so much as to make it unable to talk doing them. So I like this because we've defined for the youth what moderate physical activity is. And then there's a whole bunch of examples, and they can even add their own. And we mentioned that it could be sports, it could be activities, it could be chores or work. And then the second question is, do you engage in these most days of the week? In other words, on a regular basis. And it's just yes or no. So just 2 questions. The screening survey is for the youth. It's not for you. You're not going to collect it. It's just for them to increase their awareness on this specific topic, on this particular behavior, this focused behavior, which is moderate physical activity. So you'll make copies of that and distribute that. If you present your lesson online, you show this online, and then they can complete it on a blank sheet of paper. So very flexible. You can do this lesson online or in person. We cover all of that during our 2-hour online program implementer training. So here's your script. I just want to show you how the script goes. Because all PPW programs are scripted, that reduces the amount of time needed for training. It also increases the fidelity and efficacy of implementation across time and providers and settings. And all you need to do is practice your script. You practice your script, pretend you're presenting it 3-4 times out loud, with coordinating with your slides, you're ready to go. So it makes it very, very simple to provide an effective program and lesson. So you've got an introduction. So you have an introduction to the program. You know, you could be your wellness instructor, whatever title you want. And they're going to talk about habits that will make you look better and feel better and improve your performance in nearly every aspect of your life. First 3 lessons will address physical activity. Now, if you're going to change that, you're just going to have maybe 2 lessons or 1 lesson on physical activity. You could easily change that script. Today's topic is moderate aerobic physical activity. First thing you're going to do after that introduction is you're going to screen them. So you're going to hand out the screening survey. It's all laid out right here in directions. And if you're presenting this individually, this is the script for providing this one-on-one. This is the most tailored approach. This is the most powerful approach because it's tailored. So if you have the opportunity to present it one-on-one, that's ideal. If you have any high-risk youth you already be using, especially important, I think, present it one-on-one. So here's your script to provide your program one-on-one. And what that means is based on how they answered their screening survey. So for example, if they answered yes to one or both of those screening survey questions, you're going to read this right here, this part right here. Congratulations. Getting moderate aerobic physical activity, especially most days of the week, is critical to being fit and active. So you're going to tailor. If they said no to both of those, then you're going to say getting moderate intensity physical activity will make you look and feel more fit and active. Set a goal to start getting 30 minutes of physical activity most days a week. So you provide positive feedback or neutral feedback, nothing negative, so you don't want to tune out your youth from listening to you. Then you're going to present the positive behavior image feedback. There's your script. Notice right there, it's telling you there's your slides, there's your first slide, there's your second slide. Then you're going to talk about what are the risks to those positive image and benefits. That's this slide here. And then you're going to give them the recommendations. That's your last slide. And then you're going to go right into your contract. So it's all laid out very beautifully, very easily presented. And here's your contract. Let's take a look at it. Well, sorry, the group script is next. So let's say you're presenting it to 2 or more youth, then you'll follow the group script. It's less tailored, but still very much tailored in the fact that every individual youth in that group are going to complete their own screening survey about their own health, and then they're going to complete their own goal plan. So it is tailored to their own situation, behaviors, and needs. So if you use the group script, again, you have an introduction, same slide, so you can toggle back and forth between implementing this for one youth at a time and groups of youth without much problem. You just change scripts. Here you're going to actually ask the group which of these have they done in the last year, and you'll have hands raised and you'll highlight the social norm that my peers are physically active. Then you're going to present the positive feedback. You're going to show your slides, more positive feedback. There's a couple more slides, how alcohol and drugs interfere slide, and recommendation slide. It's all laid out there. And then you go to your goal setting. Okay, so screening, feedback, goal setting. All you have to do is decide, are you going to present this to youth one-on-one or in a group at that particular time, and you'll choose that appropriate script. What does the goal plan look like? Well, for the moderate aerobic physical activity goal plan, they're going to, I don't want to miss anything. Look at the highlighted message. To look and feel physically fit and active, pledge to continue. We're going to give them the benefit of the doubt. Continue to avoid alcohol, tobacco, drug use. You can include whatever you want in that: e-cigarettes, marijuana, and complete the following goal plan to increase your moderate physical activity during the next week or month. I recommend weekly goals are better. Short term is better than a monthly goal. So, but it's set up so you have that flexibility. If you only see your youth every month, you can use monthly goals. Then, number 1, what moderate intensity physical activities will you do in the next week or the next month? They could check those off. and they could add others if they want. And then 2 through 6 identify planning goals. How many days during that week or month? 1 day, 2 days, 6 days. What days of the week? Tuesday, Wednesday, Tuesday, Thursday, Monday, Wednesday, Friday. How long each time? 10 minutes, 15 minutes, 60 minutes. Location, specific location, and with whom? By yourself, with a friend. And so this helps them think through the process, and then that will increase their planning and their likelihood of success. Then they sign and you sign, so critical, your signature to increase motivation for change. And then a very important critical message for you to read to them to increase their motivation to post their goals and to track them. And that's lesson 1. And then you can go on to whatever other lessons that you want. Okay? So that's in your manual. You can present any number of these 6 lessons or all 6, just to show you how they build on each other. Let me show you. Let's go back to, well, let's go to 6. Let's go to lesson 6, which is sort of the culmination and reinforcement of all. Well, I can go back farther. Let's go back to, like I did with the slides. Let's go back to the food lesson first. That's lesson 4, which I think is an awesome lesson. I think they're all awesome, actually. But let's go to, here we go. So let's go to the screening survey for lesson 4, which is healthy nutrition. There's only 2 questions again. And so there's never many questions in the screening survey because it's very narrowly focused. So here it's, have you eaten 5 or more fruits and vegetables? Servings most days a week, and that's defined as a piece of fruit, a cup of fruit, etc. And then as your daily diet mostly consists of these healthy things. Yes. So it's just 2 yes or no questions. And then here it's our last 3 sessions were about physical activity. Our next 2 are coming up are about nutrition. So there's a little that's sort of built into the introduction. When you go to the goal plan, and again, you'll pick your individual script or your group script. Notice the goal plan. It's a great goal plan because they get to pick any fruits that they want to try eating in the next week or month. Look at this great list, and they could add others. Here's another great list of vegetables. So we're really targeting in on those fruits and those vegetables. But we're not just doing that. We have these other healthy foods as well. And then, of course, they're going to set a goal. How many servings and when and where and with whom. So very, very good. And what I wanted to show you is the next lesson, the next screening survey builds on that. So the first 3 screening survey questions will build on each other because there are 3 types of physical activity. The 2 nutrition will build on each other because look at the first screening survey question for the lesson in monitoring food and calorie intake is, did you eat 5 or more fruits and vegetables last week? Did you eat other healthy foods last week? And then the calorie intake monitoring questions, which really are good. Drinking regular water intake, limiting fast foods, smaller sizes of food, not skipping meals, really limiting your television screen time, very, very important messages. And then all the way down to the last lesson, which again is sort of a culmination and a review plus new content because it addresses sleep and stress control. That's lesson number 6. Here's the screening survey. It sort of summarizes it all. You get 8 or more hours of sleep. Do you practice most days a week deep breathing, meditation, some kind of a stress relaxation approach? Do you put yourself in a quiet environment? So it's an environmental strategy. Do you have certain attitudes which help you address stress? In other words, accepting things you can't change. And then a social element. You communicate with friends or family And that's so important. Then physical activity and nutrition, we're sort of pulling it all together because physical activity and nutrition are essential to sleep and to stress control. Anyway, so let me stop at that point. We've covered a lot of content. I want to see what you think about any of this, and if you want to see anything else, some of the other manuals or other content. Oh, almost forgot. I almost forgot. There's something very, very important. I want to show you a couple of things from our website related to sport 2. And so let me just pull that up for you. 2 things in particular I wanted to share with you. So I'm going to grab the screen. This is preventionpluswellness.com. By the way, if you go to our page and you see this pop up, do drop in your email so that we can get you on the list and tell you when our weekly webinars are and other resources. So a couple of things I wanted to show you. You can click on the menu here on the left, or you can just scroll down to the very bottom of the home page. Either way, you can get to the bottom here, and right here, oops, that's not it. Right here, PPW programs and National Health Education Standards. If you click on that, you'll see how, and we've got it described, what health education standards are addressed by Prevention Plus Wellness programs, including Sport 2 PPW. So Standard 1, in particular, students will comprehend concepts related to health promotion and disease prevention to enhance health. Standard 2, students will analyze the influence of family, peers, culture, media, technology, and other factors on health behaviors. 3, students will demonstrate the ability to access valid information, products, and services to enhance their health. 4, Standard 4, students will demonstrate the ability to use interpersonal communication skills to enhance health and avoid and reduce health risks. 5, Standard 5, students will demonstrate the ability to use decision-making skills to enhance their health. 6, students will demonstrate the ability to use goal-setting skills to enhance health. And lastly, 7, students will demonstrate the ability to practice health-enhancing behaviors and avoid or reduce health risks. So all of these are addressed to a certain extent in Prevention Plus Wellness programs, and you could read more about that because you can see there's more content there. So I wanted to show you that. Also, if you click on menu and you click on training, here you can learn more about the 2-hour online program implementer training and a 2-hour online training of trainer. I just wanted to show you these things. They're all on our website, preventionpluswellness.com. Okay, that's all I wanted to show you. So let's take a look at what questions and comments that you have. No questions there. Let's see under the chat heading if we have any questions. I definitely like to see a MS and elementary versions. We're already used the high school version. Oh, okay, so that's good. So middle school. Okay, well, I will do that. Let me show you the middle school version. Actually, if I show you the elementary school version, I'll show you middle school because that's what you're asking for. So I will give you what you're asking for. So let me just load that new program and just give me a moment to find the files, and I will pull them up for you and give you some examples of the middle school version of Sport 2. Let me see here. This is high school version. Here is middle school. Let me just show you the slides. I think maybe this is the easiest. Remember the content you know, the table of contents is the same. So here we go. Let me just see if I can grab onto that for you. Show you these slides. So here are the middle school slides. And I'll just enlarge them for you. So you're going to see, in most cases, a little bit younger adolescents. Again, same sequence, same 3 lessons. You know, largely the same content, but you want them to see images of themselves. So you got other dynamic images. Content is very similar, but there'll be some differences. And again, perhaps one of the most important things that are different is that you're going to see these images of a little bit younger adolescents versus the older adolescents. So that's what you've got. But you have nonetheless the same 6 lessons. 3 types of physical activity, 2 types of nutrition, and the last one on sleep and stress control. So that's the middle school version. And again, look at the different images there, middle school kiddos. And of course, when you get to elementary school, you're seeing those beautiful pictures of children. So, so that's the difference. More similarities than differences, but the differences that are here are very critical to, we believe, to program efficacy. Okay, so it's tailored to those younger kids, and then of course even the children. Let me see if there are any other questions. Oops, I just shut it down. Oops, sorry about that. Let me just pull up that chat again, see if there are any others. Very pleased to join you. It's a fantastic presentation. Keep it up. Oh, thank you very much. All the way from Tanzania, Dr. Barnabas, welcome. So let's see, and the surveys and goal sheets, are they the same? Let's take a look if the surveys and the goal sheets are the same. So, so I guess one of the questions is, could you use the high school version for middle school? You might be able to get away with it for a certain extent, but again, you want, again, I can't emphasize this stuff, you want to have you see representations of themselves. If they do, then this will help motivate them. So if you have, let's say, a high school version and you're showing it to 6th graders, that's a disconnect, I think. But to answer your question, let me see if we could pull up the, okay, so what I'm going to need to do is let me grab hold of the, oops, sorry. Let me grab hold of the middle school manual for you, and then I'll pull it up. Here we go. Just take a minute. I may have too many files open at once, so let's see if I'm able to get it or not. Yeah, see, I'm going to have to, what I'm going to have to do, what you know, for those of you, that work with Zoom, I'm sure you know how this works. You can only have so many files open at once, and then it becomes a real problem. And then you can't see things don't show up, and et cetera. So let me just shut down some of these files, and then I'll be able to pull up the manual for you. Okay, so here it is. Here's the middle school manual. And now let me just grab onto the middle school manual for you. Uh-oh. What happened here? Oh, there we go. Too much toggling. Too much toggling around here. There we go. Here's the middle school manual. And so let's take a look. So the question was screening surveys, goal plans the same. I think you'll see that screening survey is very similar And so that goals plan will be very similar as well. So there may be a little bit difference in the number of, see, this one's a little bit different. It looks like it's a little bit longer, but more similar than different, to answer your question. I think there'll be more similarities than differences in the content. So that's, you know, again, the key difference, and there may be some other differences. It's been a while since I've looked more closely at it. In fact, I know there are some differences in the image terms and so on as well, to make it more appropriate. You know, high school version versus middle school versus elementary. So images certainly, and some of the image terms that are used as well. So yes, you'll get this presentation in a link in a recorded version. You will not get any PDF slides because I'm actually showing the actual manual. So I hope that answers your question. Okay, so I hope I answered that for you. Thank you for that question. What are the differences? Anything else? Anybody has any questions for me? Anything you want to say or anything that was confusing? Now is the time to let me know. I'm just opening up the questions. How soon will we receive the material? And again, the material that you received on is as soon as I can process the recorded webinar, the recorded webinar in YouTube. Once I get that recorded, that process, I'll send you the link. So you get it today. So do check for an email from me today. And remember, it will include a 1-hour CEU certificate. So sometimes that's because it's an attachment, it may be sent to your spam folder. So do keep that in mind. But you'll likely receive an email from me today as soon as the webinar recording is processed, and then I'll send it all to you today, okay? One more question. What the age does the elementary cover? It's basically upper elementary. That's correct, because you know, it really it depends on the youth and on the instructor, the teacher. We have a lot of organizations implementing our programs, our elementary school version programs to youth 3rd, 4th, 5th grade, but it really depends on the youth and their comprehension level. And when you implement this to the elementary kids, remember what you're providing them a screening survey. Now, the beauty is the screening surveys are relatively brief in Sport 2, but nonetheless, some of them have a lot of items on them. And so this will likely increase the time that you have to spend on implementing it with the little kids. So if they understand these things, we'll go quicker. If they don't, and they need to be, you know, instructed as to what you're talking about, that can take a little bit longer. So it really depends on the developmental level and comprehension level of your youth, and how much time you have as a teacher and how much time you want to spend with youth, because you have to walk them through the screening survey, and then you want to walk them through the goal plan. So, and if you have a large group, that can take quite a while if you've got young kids, but it is doable, and it's a fascinating and a very positive and holistic strategy for kids ages elementary through high school and even into young adulthood. And that's why we have the InShape PPW program for young adults. All right, that's it. I'm good. I don't see any other questions or comments. Thank you all. God bless you for what you do and for making a difference in the lives of children and families in your area of the country and of the world. And I do watch for an email from me today. If you need anything else, just reach out to me. Go to our website, preventionpluswellness.com. Check under resources. We have free resources there, and we have a whole list of great programs as well and training. I'd be happy to and look forward to working with many of you in the future. Thank you, everybody. Take care. Be well. And hopefully see you soon. Bye-bye.